California legislators grilled bureaucrats from that state today as a result of a year-long investigation by CNN and the Center for Investigative Reporting. Now, if you're a regular viewer of the program, you know the hearings centered on allegations of fraud in California's drug rehab program, a program that receives millions of your taxpayer dollars as well. Our investigation found fraud so egregious, so bad that as a result, 174 drug rehab locations were suspended, with some even shut down. CNN's Drew Griffin repeatedly, for a long time, tried to ask the people in charge of the program why they weren't doing more to stop the fraud his reporting uncovered. At nearly every turn, however, people just didn't want to answer. Watch what happened when he finally tracked down an official named Diana Dooley, who runs the agency that was supposed to oversee the rehab program.
Drew Griffin with CNN.
Oh, how do you do?
Hey, we've been trying to reach you and talk to you about the widespread fraud that's in the Medi-Cal drug rehab business, but we're told that neither you nor the program director, nor anybody at the state of California will talk to us about it.
In an uncomfortable moment, the secretary at first refused to speak.
Secretary, do you know Alex Ferdman, a convicted felon who apparently runs one of these clinics and has been billing the state of California for several years, despite the fact that there have been complaints registered with the department about him? He is convicted of a major insurance fraud in the state of Texas, but somehow was able to get certified and has been billing. I'm just wondering if there's anybody in the state of California that's concerned about this fraud.
Then finally answered a question.
The state of California takes fraud very seriously, and there are many investigations that are underway. The allegations, all allegations, are given full and fair consideration, and you've caught me running because I am late for a meeting that I'm chairing.
Well, there were certainly not a lot of answers in that interview. And then once we aired that interview, which was frankly kind of embarrassing for that official, they sent out another official to actually come on the program, answer questions that Drew and I could ask that official live. But frankly, that official didn't have many answers either. So you just took over and you have no idea what happened in the past. You have no idea who's responsible?
What my focus is on now, Anderson, is making sure that I'm rooting out all this fraud, that we have all our investigators. We are putting all resources to root out this fraud.
All this time,
over this program.
Right, for a year you've been investigating. Have you not shut down any in that year?
I can't give you the numbers on right now.
So you can't name one clinic that you've shut down in the entire year that you were allegedly investigating?
These are open. No, these are open investigations, Anderson.
Can you name one person, one of the felons who are running one of these clinics that Drew has talked to? Can you name one person, one clinic you've actually shut down or stopped paying?
Again, the focus is. Again, Anderson, our focus is on rooting out this fraud in this program.
Right, and I feel bad that, I appreciate you being on tonight, and I know your boss didn't want to talk, and I appreciate you being on, but you have one talking point, and you continue to say it, and the fact that you answer every time by saying again just verifies that you're giving the same answer over and over again. As you can see, not a lot of answers from that interview. Today, as I said, the next step, lawmakers demanding answers. Here's Drew's report.
After weeks and even months of dodging CNN's questions concerning rampant fraud in California's drug Medi-Cal system, the head of California's Health Care Services, Toby Douglas, today went before state legislators, confirmed the fraud has been out of control, and apologized.
What we are uncovering in terms of the fraud and the other issues with the drug Medi-Cal program is completely unacceptable. And I'm here to tell you that we are sorry.
While legislators grilled Douglas on why it took a news report to get the agency to act, the state has confirmed it is, in fact, now acting.
The system didn't work well, that it was a fractured system, that there was systematic failures within the state. It is true that many of the problems came to light through investigative reporting.
64 criminal cases are being investigated through the state's Department of Justice. 174 clinic sites have also been suspended, including every single clinic exposed in our Rehab Racket series.
Sir?
Wait a minute now.
Did he call back and say he's not coming?
This past July, CNN and the Center for Investigative Reporting exposed widespread fraud in the nation's largest Medicaid system. We found that in the last 2 years, half the nearly $186 million spent on drug Medi-Cal, about $94 million, went to clinics that have shown questionable billing practices or signs of fraud.
Personally, as a physician who cares for children on Medi-Cal, I am outraged to learn that people are cheating taxpayers.
Dr. Richard Pan, a California assemblyman who heads the state's health care committee, said today, as a physician himself, he's offended the fraud was allowed to go on and says as of today, it must stop.
The same people in there that are apologizing, the same people that are telling us we're now seeing all this systematic failure and fraud throughout the system, are the same people now who are telling you we're going to fix the problem. Are you satisfied?
Well, there's going to be ongoing work. I am happy to see that they have made progress, but clearly in their testimony, there's still unfinished work. They have taken steps to address sort of the immediate problem, but we need to be sure that we have the fundamental changes in place to prevent this fraud from happening again.
Drew Griffin joins me now from Sacramento. So this is a complete turnaround by the head of this department, basically admitting everything in our reporting and not trying to defend anything. Why the change?
Well, I think there is no defense. They began looking into it and found what we found, and maybe even worse, Anderson. Look, the state knew fraud was going on. They ignored the warning signs. They looked the other way, even when they found convicted felons running some of their own clinics. Anderson?
It's incredible. I mean, to see the kind of results that you were able to get on this reporting, to see that today. No one is getting fired, though. No big changes at the state health department. And the same people who allowed the fraud, they're now in charge of cleaning it up, right?
Yeah, the same people, I might add, that you and I interviewed and were trying to defend the program just a month or so ago are now saying that, you know, they are going to clean it up. They are going to do something. Lawmakers say they're on it now. They're going to give this department exactly 1 year to permanently solve the fraud problems, or as one lawmaker told me, they'll solve it themselves. But Anderson, just this year, 36 million taxpayer dollars have already been sent to these clinics that are now suspended. So we're talking about a lot of wasted money here.
It was so frustrating when we had that guy on from the program who, you know, was saying, well, he had no idea who, previous to him getting to his position, was responsible for oversight and who dropped the ball. He's not able to name any names. Really frustrating stuff. Drew, we'll continue to report on. Great reporting. Thanks, Drew. If you've got a tip for Drew and the CNN investigations team, go to CNN.com.